All right, Mississippi is in real trouble when it comes to the pandemic, and they are not messing around. They are now threatening 5 years in prison for people who skip COVID isolation if it involves a life threatening situation. So let's take a look at what is going on here. COVID-19 patients must isolate or face fines under the new Mississippi Department of Health order. As COVID-19 cases across the state continue to surge, state health leaders are hoping a new order will encourage people infected to self-isolate. Friday, State Health Officer Dr. Thomas Dobbs handed down a mandate that all individuals, vaccinated or not, who test positive must stay home upon learning they are infected. This is the key part. Individuals who fail to do so could be charged with a misdemeanor, punishable by a fine of $500, 6 months imprisonment, or both upon conviction. And then here's the key line. If a life-threatening disease is involved, failure to follow the order could result in a felony charge, carrying a fine of up to $5,000, 5 years in prison, or both. The news comes as Mississippi continues to report thousands of new infections daily, and as it leads the nation in new cases per 100,000 inhabitants. There are people saying this is crazy, this is too much, but understand what is happening in Mississippi. Mississippi, at baseline, this is pre-COVID and during, just aside from COVID, Mississippi is 50th out of 50 in healthcare rankings in the United States. This includes access, cost, and quality. Okay? Mississippi is also the second least vaccinated state in the country. They're ahead of only Alabama, and even then only by half a point. Basically, Mississippi and Alabama are together the two least vaccinated states in the country. Mississippi is out of ICU beds as of 2 weeks ago, when Dr. Leanne Woodward tweeted, there were 0 available ICU beds in Mississippi as of early this morning. None. That means hospitals across the state may not be able to provide the level of care needed to you or your loved one, not just for COVID-19, but for any emergency care. Understand that. This affects everybody. Put COVID aside. This affects vaccinated people who get COVID and unvaccinated people who get COVID. But this affects people who just are driving, an activity that is not without risk, and you get into a serious car accident and you need an ICU, and the ICU is full overwhelmingly because of anti-vaxxers who have COVID and are in an ICU, or whatever it is that leads to you being at the hospital will be full. So yes, Mississippi is taking this seriously. They're saying you risk 5 years in prison if you test positive and don't isolate. Now, meanwhile, by the way, Alabama hit -11 available ICU beds. So exactly what that means varies. -11 could mean they have 11 people who should be in the ICU, but there's no room for them and they're being some other way accommodated. Or it could mean that they've basically set up 11 kind of like emergency ICU type beds, even though they're not really ICU beds. Regardless, negative ICU availability is a very, very bad thing. So that's what's going on in Mississippi. That's what's going on in Alabama. And increasingly, we are seeing children hospitalized with the virus. So extremely serious stuff going on. And good for Mississippi for doing something.